Great. Well, thank you all for coming. I'm Corey Shapiro. I'm a member of JCPA's Board of Directors and Vice Chair of the JCPA Policy Committee. And thank you all for coming here today. At this session, we have some amazing advocates here to discuss their important work advocating for policies that reflect our Jewish values of making a better world for folks facing difficult situations. And these women will share some of their experiences, but also, more importantly, we'll be discussing with you how you can use your own Jewish voices back in your communities to advocate for the most vulnerable in your communities. Each of our panelists will speak for about 5 to 7 minutes, and then we'll open up for some questions. Our panelists today, we have Darcy Hirsh, who is Director of Government Affairs for JFNA, the Jewish Federations of North America, and the Washington rep for the Network of Jewish Human Services Agencies. We have Dorian Karp, Senior Advocacy and Policy Manager at Jewish Women's International. We have Jennifer Laszlo Mizrahi, President of Respectability, and Liza Lieberman, Director of Public Policy at MAZON. And I'm going to let each of them, if they want to explain more about what they do as part of their presentation, but I'm going to get right into it and have Darcy start.
Great. Thank you, Corey. First, let me say what a thrill it is to be on this panel with such esteemed, incredible advocates, some of my favorite people. So I'm Darcy Hirsh. I am Director of Government Affairs at the Jewish Federations of North America. We represent 146 Jewish federations around the country on Capitol Hill. And as Corey mentioned, I'm also the Washington representative for a fairly new organization, the Network of Jewish Human Service Agencies, which represents 140 Jewish family service agencies, Jewish vocational agencies, essentially the spectrum of Jewish human services around the country. So we're here to talk about Jewish poverty and other issues confronting the community and that comport with our Jewish values. And let me just give you statistics about Jewish poverty. The official poverty line for a family of 4 is around $24,000 a year. 16 to 20% of Jewish households are earning less than $30,000 a year. So that may be higher or lower than what you expected. Those, the highest populations that are living in poverty are older adults, Hasidic Jews, and individuals with disabilities. And the highest population of Jews living in poverty is in New York City. I want to mention a very important subpopulation for our services and for our community. There's about 80,000 Holocaust survivors living across the country. 1 out of 3 Holocaust survivors are living in poverty. These individuals are at least 74 years of age. Most of them are much older. So it's really become a priority for our community to ensure that these people are living in dignity in the final years of their life. The Jewish family service agencies that we represent, that many of your CRCs work with on a daily basis, serve individuals living with poverty in many ways. And you know that Jewish family service agencies serve the Jewish community, but many serve mostly non-Jews. So certainly it's a Jewish value to serve all of those in need. And the ways that we serve individuals living with poverty, it's by helping them with entitlement screenings, supplemental food assistance like food pantries, emergency financial assistance, and subsidized transportation, mental health care are just a few. Jewish funding tends to be the last funding that goes to these human services. We rely in great part on federal funding, which we'll be talking about. In fact, the Avichai Foundation did a study in 2018 and said that Jewish donor support for Jewish poverty is actually one of the lowest priorities as far as what funders are interested in giving to. So that's part of the reason why it's so important that we partner with federal and state governments to support these communities. So, considering the federal legislation, what are we doing? I'm going to let my colleagues speak more specifically about what they're working on, and JFNA and the network work in collaboration with them in many respects, but I'm going to talk about older adults briefly. So the Older Americans Act was an initiative that was launched during President Johnson's Great Society Initiative, and it basically provides funding and supports to help older adults transition in place, transition in their communities, and avoid institutionalization reauthorization. That bill is up for reauthorization every 5 years, and it's up for reauthorization right now. It actually passed the House overwhelmingly a few months ago, and it could come to the Senate floor this week. So if you're meeting with your senators today, if you go on an advocacy visit, ask them to reauthorize the Older Americans Act and expedite it and move it quickly. Many of you were involved in JF&A's initiative for the Time for Holocaust Survivors Act, which was a bill we worked on to help augment the Older Americans Act reauthorization to provide more funding for Holocaust survivors and also individuals who've experienced trauma. Those changes that you advocated for were put into the House and Senate Older Americans Act reauthorization, so now we're at the final stage. So this is really exciting. We're almost there. If you're meeting with your senators, talk to them about it. The other issue I'll talk about briefly, as far as supporting the social safety net, is the onslaught of regulatory proposals that the Trump administration has proposed over the past several years. I'll let my colleagues speak about those that are in their arenas, but specifically, the Trump administration has proposed to raise the poverty level, which would decrease the amount of people eligible for benefits. And most recently, last week, there was a proposal that would decrease the number of people eligible for Social Security disability benefits. So our Washington office has been very, very involved with responding to these constant comments. And that's something we can talk about later if your local communities are interested in engaging in advocacy around that.
Great. Hello, everyone. As was mentioned earlier, I'm Dorian Karp. I'm the Senior Advocacy and Policy Manager at Jewish Women International. And our goal is to empower women and girls and end violence against women. We do that a bunch of ways, through programming on college campuses, through leadership programs, and then through my work, advocacy and policy work, representing JWI and standing up for women in the Jewish community and all across the country. So what I'll be talking about today is what I work on every day, and it's the women's issues. So we live in a system, as I assume all of you know, that disenfranchises women in almost every way you can think of. In 2020, women remain undervalued and continue to work more, earn less, and experience multiple forms of violence, both in the home and in the public sphere. Women earn on average 80 cents to every dollar a man earns, a white man earns. Women make up nearly 2/3 of the elderly poor in our country. Nearly 1 in 8 women, over 15.5 million women, live in poverty. And nearly 3 in 5, 58% of all poor children live in families run by a single mom. And even as more women are graduating from high school and going to college and getting their bachelor's and master's and PhDs, we see a stagnation in equality in our country. So why? After years of trying to stand up for equal rights, why are we still here in 2020? So, I could go on and on about this, the sociological, historical, religious reasons why this is the case, but this is not the place for that. So I will stick to the gaps that exist in our country and the policies that I work on to try to impact those changes and close those gaps. The first one is paid family leave. We are the only developed nation in the world that does not understand the moral imperative as well as the economic benefit of providing paid family leave to all parents. And at JWI, we believe that this should change. So there's the Family and Medical Insurance Leave Act. The short name for that is FAMILY. The Hill loves their acronyms. And so that would provide 12 weeks of partial paid leave, 66% up to 66% of income would be provided to all parents. And if you're on the Hill, we'd appreciate you plugging that. There's actually a hearing in the House this week on the Family Act. There are not enough workplace protections for pregnant workers. Despite existing protections, not enough is being done to protect these women. And there's the Pregnancy Workers Fairness Act. which would clarify that employers must make reasonable accommodations. So here we're talking about the EMT who is pregnant, whose doctor says she can't lift more than 50 pounds, and her employer won't provide her an alternative, and so she has to quit her job. We're talking about the cashier that's checking you out at the grocery store, who isn't given a stool to sit on during her 8 to 10 hour workday on her feet, and has to quit her job. All we're asking for is reasonable accommodations as provided through other disability services. We don't have mandated paid sick days in our country. Right now, moms who do the majority of caregiving in our families, in our communities, risk their job every time they have to stay home to go to the doctor or take their kids to the doctor. They're having to choose between putting food on the table and taking care of a sick child. Should not be the case. There's a Healthy Families Act, which would allow millions of workers to take time, paid time, safe time, to take their child to the doctor. There aren't enough resources going to support survivors of intimate partner violence, of domestic violence, sexual assault, dating violence, and stalking in our country. The Violence Against Women Act has been stalled in the Senate for almost a year now. So we're hoping to see that pass through. And lastly, there are incredible barriers in states across our country to access reproductive health care. Both healthcare in terms of birth control methods as well as abortion. In recent years, we've seen the anti-choice movement proliferate thousands, hundreds of laws across our country in states to restrict a woman's right to choose and to make self-determination about her own body and her family. At the state level, we continue to see competition and who could pass the most draconian laws and the most laws and eliminate choice. On the federal level, we see regulations to prohibit organizations, both domestically and internationally, from providing referrals for family planning. And we see regulations to allow organizations, healthcare providers, and individuals within those providers to discriminate in our healthcare system. Women are denied an abortion, that are denied abortion are more likely than women who have access to experience economic hardship and insecurity later in life. And laws that restrict access to abortion may result in worsened economic outcomes. There is a bill for that. It is the Women's Health Protection Act, WHPA, as it is known in shorthand, and it's also going for a hearing this week in the House. And it would prohibit any level of government from imposing limitations or requirements on abortion services that are burdensome, similar to other medical care services. It would, it would prevent states from imposing these horrible laws that are really harming women across our country. It's a vicious cycle, right? We see this. Poor women have less access to reproductive health care and abortions, and when they have less access and have the child, they aren't supported by policies in our government, which has them stay in poverty or get even poorer, impacting not only themselves, but their children, their families, their communities, and the economic security of our country. So, yeah.
Hi, I'm Jennifer Laszlo Mizrahi from Respectability. We're a nonprofit organization that fights stigmas and advances opportunities for people with disabilities. I'm very delighted that my board member, Vivian Bass, is with me here today. She really leads so much of our important work. I just want to start by asking how many people in the room either have a physical, cognitive, sensory, mental health, or other disability, or you have a family member or loved one with a disability. If you can raise your hand if you can. So you see how many people this impacts. 1 in every 5 people has a disability. The older that you are, obviously, the more likely you are to have a disability. So there's 6 million children in America who have disabilities that we know of. The majority of them are children of color who deal with these multiple marginalized identities, being largely due to structural racism in an under-resourced school that doesn't have the special educators that they need, doesn't have the mental health supports that they need, doesn't have the testing that they need. The older you get due to accident, aging, and illness, the more likely you are to have a disability. Rather than talk about, the different issues or bills, I'd like to talk for just a couple moments about some framing. I've worked in Washington for 3+ decades. I love Washington. I love politics. And you all know what politics are. It's poly, which is many, and ticks are blood-sucking animals, right? I really love politics. And I work in very bipartisan way. And in fact, for 7 years, I co-officed with Frank Luntz, who's a Republican pollster, and Kelly Ann Fitzpatrick, then Conway now, was actually one of my office mates. And so when I think about public policy, I'm always trying to think, how do we reach across both sides of the aisles? So I'd like to talk about a focus group that we did on disability issues, where all the people in the focus group worked on Capitol Hill or in Republican think tanks. Everyone was a Republican and a conservative. And how do you sell a poverty agenda, a social justice agenda, to a Republican member's office? So I want to give you some hints on how they perceive it. Number one, it is hard for them to go to work because every 15 minutes they're scheduled with another group that is trying to win the oppression Olympics. They come in, the dying cancer child, the person dying from AIDS, the person with ALS, the school system that is broken, the racism, the anti-Semitism. If you go into a congressional office talking about how everything's terrible for your population, you should just know that they are shutting out what you are saying, and that conversation is pretty much over. So you should really start by trying to connect to people by saying something like, I'm here to talk to you about whatever the issue is. Do you know anybody like that who's experiencing that? And how do you feel about that? And what have you found successful on that? When I look at our population that we work with, people with disabilities, that's 1 out of every 5 people, 1 out of every 4 adults, disproportionately experiencing poverty. We don't talk about asking for more money. We talk about breaking down silos, creating collaboration, cooperation for what we call a cradle-to-career opportunity pipeline. Because whether you're looking at the infant and toddler program, whether you're looking at SNAP or TANF, et cetera, there are provisions in all this to help people achieve their hopes and dreams. But people with disabilities from the cradle are told that they will never work, that they will live on government benefits their whole life. I know this myself as someone who's dyslexic, and as a parent, when my child was diagnosed with issues and we were told our child would never succeed. Don't even worry about school, because it's just not going to happen for your child. I'll tell you that my child wound up graduating with the highest honors at Walter Johnson High School with literally a perfect SAT score, getting competing full scholarships to engineering school because we didn't listen. But the whole system for children with disabilities is about how you will fail and you will spend your whole life on government benefits. There are literally 45 different government programs to help people with disabilities get jobs. They literally were never talking to one another. They didn't know one another. They were not collaborating. So the more that you can talk to Republican members about getting these programs to stop the failed bureaucracies and sit in a room together with an employment-first agenda that enables people to lift themselves up by their bootstraps to the extent possible, that really will resonate with Republicans. That doesn't mean the social safety net isn't important, because it's absolutely, utterly necessary. But it shouldn't be the only thing you're talking about. Talk about the social safety net, but also talk about the opportunity agenda. Again, I encourage you to try to avoid the oppression Olympics. Try and talk about the opportunity for their constituents to have lives of dignity and success and contribution where they can make a positive difference. So I look forward to the Q&A. I'm really honored to be with JCPA. You all are amazing people. This is an extraordinary opportunity to be with other people who care about such a broad array of social justice issues. David Bernstein and the whole team, I'm really grateful to your staff and your lay leadership for the great work that you do. So thanks for this opportunity.
Good morning, everyone. Excuse me. I'm Liza Lieberman. I'm with MAZON, a Jewish response to hunger, and it is lovely to see many friendly faces and some new faces. Thank you again to JCPA for having us and for including us in this very esteemed panel and really important discussion this morning. So many of you have worked with MAZON, a Jewish response to hunger. We are working in communities all around the country trying to combat hunger and end hunger and address its causes. Over 35 years of this work, we've realized we're working with food pantries and soup kitchens and multi-service agencies and congregations around the country. We've realized a really important point. We are never going to food bank our way to end hunger in this country. It's just not going to happen. The scope of this issue is so vast that that's not going to happen, and there's a really important role for policy, and there's a really important role for the federal government in particular to play. There seems to be this understanding in today's this misunderstanding in today's political climate that if we reduce funds for SNAP or for other government assistance programs, the charity sector can pick that up, and the private sector can pick that up. And many of you are in your communities doing this work, and you know that those agencies are in many cases already quite stretched, and that charity alone is not the answer. For every one meal provided by a charity the charitable sector, about 10 meals are provided by SNAP. And that's real food that real families and real kids are getting. So what we're doing is, in today's political climate, we're really trying to defend and protect the basic needs, the social safety net, and the federal nutrition assistance programs. And what we're doing is that we've identified a few select populations that face some unique barriers to assistance from those programs. So we're talking about veterans and currently serving military families that are facing some unique issues of stigma and barriers that prevent them from food security. Additionally, Native American communities and rural and remote communities, seniors, and in particular LGBT seniors. Additionally, college students is another group that we've been seeking data on for a long time about the unique needs, and that of course has a lot to do with college affordability issues. So as I mentioned, the bottom line right now is protecting the safety net, and a lot of that in today's Washington has to do with the Supplemental Nutrition Assistance Program, SNAP, which has been referenced. This is by far and away our country's front line to combat hunger, and it is a critically important and amazingly effective program, actually. It is authorized in the Farm Bill every 5 years, and in 2018, at the end of 2018, it was authorized by a very delicate bipartisan fight and compromise that many of you were involved with. Congress explicitly decided to protect SNAP and in some ways to really strengthen the program authority, the program integrity. Unfortunately, since December 2018, we've seen the Trump administration propose regulatory attacks that Darcy mentioned and that were mentioned in the last panel as well, that would really restrict SNAP in some really dangerous and troubling ways. So we've seen 3 explicit proposed or finalized SNAP rules that by USDA's own estimates would cut SNAP benefits, and this again is food that people use to to buy their groceries by $50 billion over 10 years. So we're talking 3 to 4 million household people who would lose assistance entirely, and 6 to 7 million who would people who would get less assistance. So this is incredibly troubling, and we've been doing a lot of this work with our partners and with many of you to submit comments and to find out, have you looked into how many veterans actually would be affected by this? Have you looked into how children would be affected? It turns out that one of the proposals alone would jeopardize free school meals for 1 million children. And this was a statistic that actually didn't come to light at first when it was proposed, and then later we found out, and they're still going through with it. So another piece I wanted to point out about this is very front of mind. I'm sorry I didn't let you know I'd be talking about this, but the president's budget was released yesterday, and we saw some more deeply troubling. I mean, you all understand policy. You understand that there's a whole process that has to happen now, and that doesn't mean that this will become law, but some deeply troubling cuts. I mean, he's proposing $182 billion of cuts in SNAP benefits, and that's 30% of the program. And I'm sorry, that's over 10 years, but still, that is deeply troubling. We saw another repeat of a prior proposal that would supplement the traditional SNAP benefits with the idea of a harvest box that many of you might remember, which is just very hard to regulate and hard to make sure that that would be nutritious or culturally appropriate food, and is really just dead on arrival, certainly as a proposal, but very troubling that this is what is being proposed. Cuts to school meals by $1.7 billion over the next 10 years, and that would be by restricting the community eligibility provision, which is really flexibility for schools in low-income areas. Another theme that we're seeing in some of these proposals is restricting state flexibility. And I really wanted to raise this because I think that's really important for all of you in your states and localities, because we've found that some of our most effective advocates for SNAP right now are governors who are saying, no, actually, we know our SNAP population. We know where people are struggling to find jobs, or mayors, certainly in some cases. We actually know the reality of what's happening, and we need to preserve that option of being able to waive a work requirement. Or we know what's going to best meet the needs. In particular, this is true in rural communities, but really everywhere. I mean, it is critically important to preserve that state flexibility, and that is a theme that we're seeing in some of these proposals. So I think I will leave it there and look forward to your questions. I guess one other in the piece of our work that's end hunger and its causes. One other piece I wanted to mention is that the Working Families Tax Relief Act that many of you are aware of, that would expand the earned income tax credit and the child tax credit. That's another really important policy piece that has a real energy behind it in Congress, in Washington today, and in communities around the country. That's another really important tool that I think would help address some of these issues that we're talking about. So I actually brought some materials from our friends at the Center on Budget and Policy Priorities if any of you wants to learn more about that. But that's another really important tool in our toolkit of combating injustice and poverty. And thank you for all the work you're doing.
Well, I want to first thank all of our panelists for providing us that great information and providing us some good resources on what we can bring back to our communities. I want to ask Darcy a question first. We've heard mention there was a table here about the 2020 census, and it's important. And I wanted to know if you could talk about how that impacts your work on poverty issues, and how can the field help support the census?
Thank you. So as a community, we are really civically engaged, right? We have a 2020 election coming up. We're talking a lot about voter registration, voter engagement. How can we get out the vote, get people to turn out? We're not talking so much about the census. And when many people think of the census, they think about congressional apportionment, and they think that can be viewed as a partisan issue. But we're also talking about the allocation of federal funding to our communities. And there are large groups of people that are traditionally undercounted, and that has a significant impact on the social services, the funding that's available for social services. In particular, children are very much undercounted, as are other hard-to-count populations like older adults and individuals with disabilities. So there is a very broad census engagement campaign underway. As Corey said, there was a table here yesterday, but this is a really great opportunity for CRCs, local Jewish agencies, to get involved in making sure that every person is counted, so that federal resources are allocated properly. If you go to the census website, there's a map that shows you where the census count committees, they're actually called complete count committees, are in each community, and you can sit on these committees to talk with your local community members about how to reach these hard to count populations. So I would really recommend that you do that. I'm happy to answer any questions about this afterward. But the census, it's a census year, it's April 1st, but the engagement is already underway.
Thanks, Darcy. Jennifer, you talked about disability policies, and I was wondering, we've been talking here a lot about criminal justice reform issues, and I was wondering if you could talk a little about the intersection and how the disability policies might intersect with some criminal justice reform work that we're doing in the field.
Thank you so much for the question, and I want to apologize that I have a hard stop at 10, so if it's still going on, I will disappear a little early, but this is completely intersectional. 750,000 people with diagnosed disabilities are incarcerated today. So we're talking about literally 150,000 people who are deaf, 150,000 people who are at least legally blind, if not fully blind. We're talking about 200,000 people with mobility impairments, 500,000 people with mental health conditions at least. So when you talk about criminal justice, you're talking about people of color with disabilities primarily. So one of the challenges that I've had in looking at the policies that people are talking about is they're talking about ban the box, for example, and community reintegration. These are policies that I call necessary but not sufficient. They're very, very downstream. You know, the problems that could have been prevented are already in place. So who's incarcerated? It is the child of color who has a learning disability, dyslexia, ADHD, executive function disorder, mental health condition, et cetera, that didn't get diagnosed, didn't get special ed, didn't get the early intervention, and then when they got frustrated in school, they got suspended because they had poor behaviors because they were frustrated, and then when they dropped out, they are now joining a gang or getting involved in the justice system. Legally now, ESSA, the new education law, says that any child who's incarcerated is supposed to be tested for a disability, and they're supposed to get an IEP, an individualized education plan. I'd like to see the JCRC see that law enforced, because it's not happening. Kids who are being incarcerated are not getting tested for those disabilities. Their schools are not giving them the resources. They're usually in for a very short time, and then they go back to their local public school. When people leave incarceration, frequently they're still illiterate because they had that dyslexia before, and they also have a mental health condition when they leave, and they might need medication. They have no access to medication. How are you going to manage that? So you really need to look at, and some of the best work is being done in St. Louis, Missouri, where there's a fabulous program for people leaving incarceration with wraparound services that is showing some incredibly promising results. We're seeing the Annie Casey Foundation deal with diversion in a very productive way to keep people out of incarceration and get local mental health supports and other supports. This is very, very important to keep, to really realize that these are people who need help and are people who would like to be productive workers in society and would not like to be, incarcerated. By the way, 95% of people who are incarcerated eventually leave incarceration. 95%. 2/3 of those people are reincarcerated within 3-4 years, particularly those with disabilities. So we really need to get on this with wraparound holistic solutions. So thank you.
Thank you. Does anybody have any questions in the audience? We have time for one question.
So make it a good one.
Two questions.
Two questions. Great. So ask your question, and then I'll go over there. And
Mine's very fast. For those who are going to the Hill, you've recommended several acts, but you didn't give us the numbers. And when you go, that's the first thing the aides ask us when we walk in the room. So if not now, then in future or when you send whatever notes, it would be helpful to the audience if you did that.
and then do we have another question over on this side?
So I'm curious as to what is the JCPA position on more jobs? The employment rate is about 2/3. It's the lowest employment rate in 40 years, and if the hopefully, you know, we are advocating for full employment, or at the very least, let's raise the employment rate from 2/3 to 3/4. And I guess I put as a sub question, I could say, if the employment rate did go up to 3/4, how would that impact the important issues that you're working on?
So I'm going to jump in. I just asked Corey if that's okay. I am so passionate about the mistaken data around, and I'm obsessed with this. Stop talking about unemployment rate if you care about poverty. Okay? And here's why. Unemployment data only measures people who are actively looking for work. If you're a person with a disability or you've left incarceration, the door has been slammed in your face so many times that you give up. And so you're no longer counted in unemployment data. You want to look at what's called the labor force participation rate. So that's if there's 100 people, what percentage of people in that demographic are working, okay? It's the labor force participation rate. Right now, today, and one of the reasons I have to run is that the data is being released today, the disability data. 2 years ago, we had 328,000 new jobs for people with disabilities, which was a huge improvement because of employment first policies driven by governors around the country. But 1 year ago, we had only 111,000 new jobs. The new job numbers coming out today show only 29,000 new jobs for people with disabilities. But people will go on and on about the low unemployment rate for people with disabilities. Why is there a low unemployment rate? Because they gave up looking, because the door was slammed in their face, because we are not working together collaboratively, coordinated, like they're doing in Florida, which is working, like they're doing in Arizona, which is working. But so many states are losing jobs and causing even more people with disabilities, especially those of color, to not be in the workforce. So I encourage everybody here to look not at the unemployment rate, but at the labor force participation rate. And the gap is massive. Today, over 70% of Americans who are working age, ages 18 to 64, have a job, but only 37% of people with disabilities. I will also say that in the great state of Maryland, here in Montgomery County or up the road in Montgomery County, over 50% of people with disabilities have jobs, over 50%. But in Los Angeles, it's only 25%. So good public policy where governments and stakeholders and nonprofits sit together and coordinate and collaborate have over a 50% employment rate for people with disabilities, and people who don't do it have a 25%. So the impact on poverty and the impact on the need for government benefits is extraordinary. And we start by needing to look at the data that is most relevant. And every single state, the data's coming out today, Respectability is going to be posting it later in the week with a state-by-state breakdown of where every single state ranks and where you are. Please look at the data and demand that your governors pull this shit together, because it is outrageous that we are spending billions of dollars perpetuating a failed system.
If I could add really quickly, I would just say that just because somebody is employed doesn't mean that they have all of the resources, or there's lots of problems with underemployment, right? We have a very low minimum wage. Not everybody that is employed and part-time has health care or any of the other benefits that I mentioned, like leave and paid sick days and all of the services that really provide the opportunities that are necessary to have a full job. A lot of people are on also benefits because our government doesn't support them and our private sector isn't supporting them either. So just because the employment rate is going down doesn't mean that a lot of people who are employed are getting the money that they need to meet their needs.
And one more note on that. One more note on that is that there's such a discussion here in Washington about the value of work. And obviously we all want people to be working, that there's great dignity in work, of course. But the reality is that veterans who return often are going to be looking for work, but they might not be able to find a sustainable or realistic or well enough paying job or something that meets their skills. But, the vast majority of people who are receiving SNAP are working. But in some cases, they're not able to report it in the way that the state agencies need to see, or they're patching together jobs in today's gig economy. And so there's this misconception that people who are receiving benefits are not working or don't want to be working. That really is not the reality. And I think a lot of our work on the ground and in communities and with legislators is to combat that rhetoric around misconceptions around work and who is receiving these benefits.
Great. Well, I think we've run out of time. Not that there isn't enough time to talk about all these problems we need to solve. But I want to thank all the panelists for their time and for the information. And a special thank you to Jennifer for her award from JCPA, for her wonderful work that she does. And I think the rest of the panelists will be here if you have a question for them. And I also want to give a special shout out on the Pregnant Workers Act. If Kentucky, I'm from Louisville, Kentucky, and in Kentucky, my colleagues passed the Kentucky Pregnant Workers Act. And if we can get it done in Kentucky, you all can do it in your states. So thank you again.